I think it's a very important thing to know. Are we snoring or we aren't? Do we wake up in the middle of the night to go to the bathroom? Just because we are older doesn't mean it has to happen. And do we have any acid reflux, heartburns? Do we fall asleep watching TV? Do we have a hard time driving at nighttime?
Our number one nutrient for the body is oxygen. So if that oxygen flow isn't occurring, that's going to affect someone physically also. Sleep apnea really refers to when a patient goes through periods of not breathing. Underneath most current guideline, if you have 4.9 episodes of not breathing for a certain time period, that's normal. When you reach 5 and above, then you're considered mild, moderate, and severe.
I think patients really need to ask their physicians to order a sleep study. Because once you do sleep study, then you know how much oxygen intake you have. When do you stop breathing, and if you stop breathing for how many seconds, and how often that happens overnight.
In older patients like myself and in people that are even older than I am, it really comes down to same thing, cardiovascular risk. And I've lost a friend of mine who died as a physician at age 44 because just 3 nights he stopped wearing his oral appliance that was made for him, had a heart attack.
So it's very important, especially if we have diabetes or autoimmune diseases or any other disease, to make sure that we take care of our apnea.
The great thing about being a dentist and being trained in sleep apnea is that we know that certain things are related to sleep apnea. Even though sleep apnea is considered a medical term or a medical condition, there are oral manifestations as well.
The side effect of sleep apnea is heavy grinding. We call it bruxing of our teeth, and we start breaking them down.
We can recognize signs of grinding and clenching, specifically the protrusive thrusting of the jaw. The body is almost like own individual self-defense mechanism to open up the airway. Another one is GERD, gastric esophageal reflux. So that's another one where we can see erosion occurring, and usually it's happening on the lower first molars.
When I look at someone's mouth, I always check the airway. I want to make sure I see the airway pretty good when they say ah and they stick their tongue out, because the less airway that I see is a more chance of having sleep apnea and more chance of having cardiovascular disease, heart attack, or stroke when they get older.
Some people will show signs and have some symptoms, and some people have no issues, not knowing anything at all, because the body actually can build up a tolerance mentally to what they've been enduring.
You don't know till you do the sleep test. So this is important. Many patients, I've told them years after years, and finally they did the sleep test and they did have the apnea. So then they are thanking me now because they get the CPAP machine, they can breathe better. But some of those patients, about 35% of them, they hate to wear CPAP machines, something that wraps around the head and gives you oxygen, because it's constant blow for most part. I'm a trained sleep dentist as well, which is a little specialty too. And we can make them oral appliance and they can breathe a lot better by advancing the mandible. So we get the lower jaw a little bit coming forward. We measure the force on the TMJ. We make sure we are not bothering the joints, and at the same time, patient can sleep better, and they wake up, they have energy.
Because as you're moving the jaw forward, you're now stretching the muscles, which actually are putting them into a relaxed state. So just like if you went and ran 10 miles, you want to stretch your legs afterwards, it's a relaxation approach. By wearing an oral appliance, and I myself have been wearing one for the last 5 years, and I'll tell you the greatest impact that I've noticed is that I don't have the symptoms of getting up 2-3 times a night to urinate. I don't have the migraine style headaches anymore. The oral appliance, by bringing the jaw forward, also prevents me from grinding and clenching my teeth. So now it's preserving my teeth, and really what it's doing is just bring the jaw forward, and as the jaw moves forward, the tongue moves forward, and that's how they open up the airway, and in this way it allows more oxygen to get into your body. In doing so, I've noticed myself, my gastric esophageal reflux, or as we call it, GERD, has diminished. If somebody is not developing properly, a young child, we have to start to really consider expanding the arch form of the teeth so that their tongue can posture forward properly.
This is very important because you want to give patients more lifespan, quality of life. So it's not just snoring issue. We have to make sure that do they have or they don't have the sleep apnea. And that can be easily done in dentistry as well today. Thank you for watching the video. If you have any questions, you can call the office and we will take good care of you.